how much more are we going to see infections rise? Are these being contained in the U.S., or are we going to see a significant resurgence in cases?
Well, thank you for having me. It does seem like we are seeing a significant resurgence in cases across the South and West U.S., and there's every reason to expect these cases will continue to rise in the near future.
Dr. Toner, thank you so much for joining us today. You are truly one of the nation's experts on emergency medicine, and you led with a Journal of American Medical Association article on what you've learned in the first weeks of this virus. What now, from where you sit with the experience of weeks and months, what is next for this virus?
Well, this virus is spreading in the states that opened up their economies early and aggressively. And so we've been seeing case rises since about Memorial Day, as one would expect, with more interaction between people. And I expect that this will continue. We will see more states, as nearly all the states now have opened up to some extent. We will see more cases. And I fear that in some of these cases, particularly in the South, we will see very dramatic rises. You should know that in some of these, in some of the counties in the South, they are seeing per capita levels of cases and deaths that are as high or higher than New York City saw at its peak.
I saw that last night, folks. John Burns Murdoch in the Financial Times has great per capita analysis of some of the counties and states. Dr. Toner, if that's the case, we need to go to something that I think is a mystery for a lot of people, which is the effect of the virus on healthy younger people. What is the update on what the virus does to those younger who feel they're immune?
Yeah, so this is one of the paradoxical things. Most young, healthy people tolerate the virus quite well. They have a mild illness. It's not universal. Some have severe illness, but most have mild illness. But they can become the major carriers and transmitters of the virus. So whereas it's true that right now we are seeing many new cases being young people, in next and subsequent generations of transmission, as they spread it to other people, it will be spreading amongst the entire population. Well, you'll see it more in middle-aged and elderly people as well. So this is ominous.
Dr. Toner, are we going to see a big resurgence as we get into our winter? So is fall a critical moment, and what can hospitals do now to prepare for that?
I think it's a mistake to expect a fall wave. The subsequent wave is happening now. It's going to be a summer wave, if we want to talk about waves. These cases are rising now. The U.S., on a national basis, is nearly back to where we were in April in terms of total cases. We're back up to over 30,000 new cases per day. So we don't have to wait till the fall. The new resurgence is happening now. And hospitals who haven't gotten ready really need to get ready. There is no time to spare.
Is there any?
I was going to say that many of these hospitals, many of these counties that are now being affected, have limited resources. They don't have the resources of New York City, and so they're in quite a vulnerable situation.
Dr. Toner, when you look at any good news out there, is there anything that gives you hope, either that we find a vaccine sooner than expected, or that actually people that have contracted a coronavirus can't recatch it?
Well, my hope is that what we've seen that gives me hope is that the measures that we use to decrease transmission, that is wearing masks, maintaining distance, avoiding crowds, these things really work. They work dramatically well so far. It's how we made the outbreak in New York not so catastrophic, and it's how we tamped down the curve everywhere else. So if everybody wears masks and everybody maintains distance and avoids crowds, even with reopening the economy, we should be able to maintain some control over this virus, particularly if we are doing widespread testing and widespread contact tracing. I do believe that it's possible to keep control of this virus. It does not have to get back to what it was like in New York. But I'm afraid that if people don't wear masks and don't maintain distance, we could end up back like we were 6 weeks or 8 weeks ago.